And the second thing was that the nose grew completely different. And then sometimes the last twin I did, they wanted the exact identical nose, but it's just not possible to get it because the variation is so subtle that no matter what technique you use, there's always a difference in skin elasticity or skin volume or a little bit curvature, etc.
Ladies and gentlemen, welcome to another episode of the Rhinoplasty podcast with me, Dr. Cameron McIntosh. We're in the month of July and we're focusing on rhinoplasty for residents. It's brought to us by Medtronic. Everyone in the world knows who Medtronic is, so shout out to Medtronic. Thank you for enabling today's episode. My special guest today, so I'm not going to box him into one area, but if I had to say the Utrecht Questionnaire, you exactly know who I'm talking about. So this is a man who is internationally influential in rhinoplasty, otolaryngology, facial plastic surgery. It's a great honor and privilege to have Peter Lohuis on the show today. Peter, thank you.
Thank you for having me.
So Peter, if I look in your background, those stairs, I've seen them in so many webinars in the last 2 years. Where in the world are you at the moment?
I'm now in Naarden Vesting. It's a very small town in the middle of the Netherlands. And it used to be a defensive city against the Spaniards. And I'm right in the middle here. It's a very old building.
Wow. So, Peter, I find you a very interesting person. And I've known you for many years, and there's so many different parts to who you are. So let's just try and for the listeners kick off and tell us a little bit who is Peter and how did you get to where you are in your life? Because you've done lots of things, but what give us a bit of your journey to where you are at the moment.
Well, let's skip all the schools, etc. So when I was 17, 18, I went to med school. I went to the United States on an exchange program that kind of influenced my choice for either ENT, head, neck, or neurosurgery. And then I came back. I learned the American way, so I was a more serious guy. And then slowly I went into residency. I doubted about neurosurgery, but in the end, this was better for me. I like the head and neck and also the kind of patients and the diversity in what we do. So I went into residency in Utrecht. There was a good residency program with also a lot of rhinoplasty. So that was the luck factor regarding what I'm now interviewed for. And then I went from residency into head and neck cancer. And I went to what I called the Ajax of the head and neck, which was the Netherlands Cancer Institute in Amsterdam. I stayed there since 2020. So I'm working there since 2000. So I'm working there already for 22 years. And that was really a good center to do everything because no matter how crazy the cases, they were there. We started doing the reconstruction ourselves. So it was unlimited what you could learn. I still work there. Then I slowly went into academic medical center, which is also a big hospital. And there I picked up the facial plastic surgery together with Noel Trinity, you know him. I did that for a while, and then I decided to go to a general hospital and to a private clinic. So to do only aesthetic rhinoplasty and to set up a facial plastic surgery unit at this general hospital. And slowly that developed till I kind of left for Zagreb. I kind of switched the general hospital. I stayed in the cancer center. I stayed in the aesthetic center for the aesthetic rhinoplasty. And then I went to Zagreb, where I started with Boris Filipovic, a private clinic, in order to slowly copy what I saw, what was really working well in the Netherlands, which was um, cases outside the hospitals towards small centers divided over the country, which was cheaper, faster, and better because doctors were starting to focus on a few such subjects. So also there we try to develop hand wrist, with other doctors, of course, incontinence with the gynecologist and the urologist, uh, um, facial plastic surgery, general plastic surgery. So we have certain areas where we work in, and we try to do it better because you just see more volume and you discuss with your colleagues. It's multidisciplinary. We get headache surgery, all these things, which are actually not so difficult. It's not the head and neck cases, which I was used to do in the Netherlands Cancer Institute, but like rhinoplasty is perfect for that. Incontinence is perfect. You want to go in, see the doctor, have a surgery for 40 minutes, and you're done and you're cured. Not waiting for a year, etc., etc. So that was kind of the journey up till now. And since I was a resident, that was like 1994, I did rhinoplasty always. So all these years, I did rhinoplasty and slowly developed my skills. So that's like in total, I guess, 28 years or something. So
Wow.
It takes a long time.
Yeah, we're going to get into your contribution to rhinoplasty because there's a lot about that I want to chat to you about. But in terms of your patient profile that you see in Zagreb compared to you see in Amsterdam, how different is it?
More or less, I see only aesthetic patients with or without functional problems. So now I see only patients that really come for a more beautiful nose, and usually they have functional problems as well. But that's what I do now. And that slowly developed. In the beginning, it was more or less functional, and then I saw also a lot of patients that were for skin cancer reconstruction. So when they were missing half a nose or nasal wing or whatever. But I was starting mixing it up. But now my business is functional and aesthetic rhinoplasty, and usually they come for the aesthetic part because they pay for the surgery.
So, okay, I've got a couple more questions. Tell me, last year you became a somnologist. So tell me, what's a somnologist?
Sonology is, that's kind of funny story because I did all these things, man, all these long surgeries, and then they tease me now that I'm a somnologist. But it's kind of fun because a friend of mine, he was a head and neck surgeon. He started sleeping centers. And it's not that there are not sleeping centers in the Netherlands. It's like there were a huge amount of sleeping centers. I think it's the best arranged in our country comparing to United States, maybe Australia, etc. And it was COVID time. So that summer, we decided in Zagreb that we wanted a sleeping center as well. And there, the somnology is kind of ruled by neurologists. And they do a good job, but what they do is CPAP. So there's no surgery, there's no drug-induced sleep endoscopy. There's no hypoglossal stimulation. All these beautiful things, barbed wire pharyngoplasty is not there. So also the mandibular device was not being treated. So we thought that was a huge opportunity to kind of bring it all, multidisciplinary, and that's what we started doing. But politically, it was kind of important to become a somnologist because then you also did all the neurology and pulmonology. And so I did the exam, and the exam was kind of hard, I must say. I studied like 120 hours, 3-4 books. But then I passed it, and now, we kind of use it to kind of set up the somnology better. Because if there's one thing which is good for you, except for a rhinoplasty, it's sleep, man. 8 hours of sleep, you start to appreciate that more and more. You feel better, your mood gets better, less hypertension, less cardiac problems. All atrial fibrillation is, it's, at least half of it is related to poor sleep and sleep obstruction. And especially for the sleep obstruction, that is what we see. And still the other stuff like insomnia, hypersomnia goes to neurologist. But you get a broader knowledge, and it's kind of interesting. And for the nose, well, we saw those patients already. I must say that for the apnea, it's not so much related. Sometimes it makes the CPAP work better, or it's more comfortable, of course. But we did that already. But the complete knowledge about sleep increased enormously. And since then, I really, really do my best to sleep at least 7 hours every day, because I'm sure that's a life changer, really.
No, that's cool, Peter. Congratulations. Adding to your PhD, adding that somnologist. But I'm sure, I remember speaking to Faisal a few years ago, and you said there's nothing better than a rhinoplasty and a good night's sleep. But Faisal said if you have a good rhinoplasty, it can be good for your sex life as well. So maybe they all add together, eh?
Yeah, but he makes all these pointy tips.
Okay, Peter. Well, I know off air we were chatting about you operating on twins from the same egg. Tell the listeners that story, please.
Oh, that's kind of interesting. I think I have like 5. And all right, in the Netherlands, there was a guy called Verwoerd. He was a professor in Rotterdam, and his PhD was about growing centers in the septum. And when you get a small trauma in a young childhood, and also already birth is like a small trauma, that influences the way that the skull and the nose start growing. So dorsum, but also maxilla, is all coming from these growth centers in part. Okay, which means that if you have a one-egg twin, which is completely identical with DNA, and something happens, like a fall, or maybe the birth was different, etc., it starts to diverse. And that's not only for the nose, but also for the volume of the cheek, light, shadow, etc. And you have to see like this, that sometimes one girl can end up much more pretty because all these different correlations are just much better. What is beauty? It's like, it's the combination of things. And that was extremely interesting. So that was one. So that was my first twin that I did, that 2 girls didn't look the same. One was much prettier. And the second thing was that the nose grew completely different. And then sometimes the last twin I did, they wanted the exact identical nose, but it's just not possible to get it, because the variation is so subtle that no matter what technique you use, there's always a difference in skin elasticity or skin volume or a little bit curvature, etc. So the first thing is that it changes the growth. That's one, and no matter how identical they are. And the second thing is, as soon as it's changed, you can never make it the same anymore, because the differences are so subtle that just doesn't work. Also, the face is different, so the nose will never, the same nose will never look the same in that different face. Also, because the volume of the maxilla is a little bit different. It's kind of interesting.
No, it's a humbling thing, this rhinoplasty. I did twin brothers, very identical, did almost exactly the same operation on them. 2-year follow-up, and I think to myself, the first guy walks in, beautiful result. Next guy walks in, I think, I cannot believe it. I operated them like a day apart, and the results were completely different. But anyway, I don't know. Rhinoplasty keeps you.
I see that too. It's really interesting. So, whenever you do something in rhinoplasty, there's also a little bit luck factor that you kind of, the gods help you to heal a little bit in the right way, because the material is different. It's very humbling.
Okay, so Peter, changing track slightly, I want to chat to you a bit more about the Utrecht Questionnaire. So all those years ago, did you at that time even remotely think it would go around the world and be translated in so many languages, et cetera, et cetera? I mean, tell us, there's listeners from 70 countries around the world. So what I'd like you to do is tell us about the study and the questionnaire and how people could possibly get a hold of it, to download it and use it in their practices.
Yes. So it was like this. In the Cancer Institute, where I worked, we developed for laryngectomy the speech prosthesis, right? That's what we developed together with a medical company. And what we did was like this. We developed it together with them. We did the research, and as soon as the product came out, and it's world famous now, almost everybody is using it. As soon as the product came out, it was combined with the research. So you bring the product and you prove straight away that it works extremely well, better than others, and then it was brought on the market. All right. Now, how we did it was with long questionnaires. We had a psychologist who did the whole day nothing else than seeing these patients and filling in the questionnaires, and then there was statistics, etc. But as a doctor, you never saw the information in that questionnaire. So I wanted something which was short, but still validated. And validated means that it measures what it's supposed to measure. Now, when you have 100 good questions, all right, of course, it's going to be a little bit better. But when you have 5 questions, which are kind of simple, but you can prove that it's enough, then you have a tool which you can use in your rhinoplasty techniques to compare the quality of the techniques. And that's why it's so popular. It was a very small questionnaire. It took me 4 years to validate it. It was very well done with 7 reviewers. They asked me after 3 years to do the whole thing again so that the redo would also be the same. But as soon as that was proven, and then it was a beautiful tool to publish articles. And then it became nice because for me it was nice because I immediately see on my desk, they fill it in before they come in the office. I immediately see what they think of their nose. And because I know how it's related to others, I say, all right, this, and I can make it this much better. Because my average on that questionnaire on the visual analog scale was 4.52. That means if you came in with a rhinoplasty, which was a 3, I could say, well, statistically, on average, you are going to have 3 plus 4.52, a 7.52. But I know, because of my experience, if you are on the good side or on the bad side. For example, when you have thick skin, then it's like hard to bring them to a 10. But if you have beautiful thin skin and only a little bit moving parts to stabilize the profile, then you can sometimes get your 10, And whenever you have something which is between 8 or 10, it should be enough, because what is the ideal nose? It's depending on so many things. But at least I had something to show how good I was doing. And later on, my fellow did it, and he had like a 3.5. So he was 1 point lower, which is kind of normal because he was younger. And then more people started using it because it was validated. It's in Persian, it's in Spanish, I believe, English, like 5, 6, 7 languages. So
Right.
it's kind of a good tool to use.
No, it's an awesome thing, and I know, like, it's part of putting you on this the Rhinoplasty Residence Month in July is just how much teaching is such an important part of what you've done. I mean, I know you've published 2 books as well. Tell us about that.
First book was after I finished the head and neck. So then I wrote a book together with H.D. Fuik about facial plastic surgery. At that time in Europe, I think I was the first one who did the European facial plastic surgery exam in Washington that time. So I think that was very new at that time. I started writing books. I started gathering the chapters. Some chapters I saw like 12, 13 times because it was all new. But, in that way also I learned a lot myself. And after 4 years, we published it. I think now it was printed once, but now there's so many books that it would be ridiculous to do it again because it's completely out of date and the quality became so much higher. But that's kind of interesting that in those 20 years that facial plastic surgery became such a steep gradient. It's still moving forward. So it's not that we are ending now. It's like getting better and better and better.
That's awesome. So, Peter,
And the other book was for rhinoplasty, because that was one author, so I wrote it myself, and there were all these things in that I wanted to show, like the questionnaire, my results. Eugene Chardy once told me, he said, all right, if you want to write a book, you have to do at least 10,000 cases, otherwise you will not get the material. And that's kind of true. You need a lot of cases in order to get enough material to show enough examples. I had students to make drawings, etc., etc. Yes.
And how can the listeners get hold of those books?
You just Google my name. One rhinoplasty book is via Kugler Publications, kuglerpublications.com in the Netherlands. And I'm sure you can still get there the English version and the Spanish version. They're very illustrative.
So, Peter, in terms of what would your advice be to listeners who want to come and do a fellowship in facial plastic surgery?
Well, also that changed, because I had to go Norway, London, went to Tony Bull, I went all over the place. But, in the United States already there were like centers where you could learn the full scope as long as you stayed a year. I think I was a director of education from the European Academy of Facial Plastic Surgery. And we kind of developed the systems that you could do like 4 observerships of 3 months, or you would do 1 year and then maybe go like 8 weeks somewhere else. But at least you had to fill up the year. I think the best is actually to stay somewhere 9 months and then choose 3 months a specific item for somebody who is world famous. But go to a center where they do it all, like not only a rhinoplasty, but facelift, reconstruction, skin programs, whatever you can think of. Because when you can see it all, then you know the full scope, and then you can kind of limit yourself to the things that you like best.
Yeah, cool. Okay, so here's a question for the residents who are listening. When the patient is coming to your room for the first time you're going to be examining the patient, taking a history and stuff, for you, what would be the 3 key items you have to nail in your consultation before surgery with patients?
When I see them, what I want to know?
Yeah, if someone's, I'm asking you a question, I'm a resident, I want to start my rhinoplasty career, and I'm saying to you, Prof. Peter Lohuis, you've been around the block. What are the 3 things that are the most important things I need to concentrate on when I'm seeing the patient for the first time in my rooms?
Okay, well, if you mean a resident, to make a career, then it's the 3 A's. It's like, you need to have some skill. That's one. You need to have all the knowledge, so you can switch during the operation to all the different techniques. And you need to have an artistic feel, because that's what, with rhinoplasty, it's not for everybody. It's some people just have no feel for how to position this nose in a nice way in the face. And that artistry you kind of have to have by DNA. And otherwise you have to learn it, but it kind of doesn't come so quick. So it's skills, and it's knowledge, and it's a lot of artistic feeling for the aesthetic rhinoplasties. When you mix up all 3, then you get to a next level. And I think also that you just need time, because I've been doing it for such a long time now, and I'm still learning. And it's really a different kind of surgery. And the thing is, there's such a variation in anatomy, but also such a variation in taste. And I have to be careful now what I say, but now you get via Instagram, you get all these really aggressive publications by people who are not that experienced, I think, and have a set of skills which is always the same. And then you get sometimes rhinoplasties will look really funny, which are irreparable anymore. And that's the danger now of all these education. As soon as you start, and how humble you have to be. Sometimes it just will not listen at this anatomy and this tissue healing. Then you bring a patient into real big troubles. So I think that you need a certain learning curve together with an experienced surgeon before you start to work on a patient's nose, which is in the center of the face and which he can completely destroy a life. And I'm serious about that. I've seen, I think 30% of the revisions that 30% of what I do is revisions. And these women are suffering, man. They for years, they put big makeup. But also the guys, they're really, really not happy and insecure about themselves because they feel maltreated. And they understand that it's like hard, you cannot really blame somebody. But at least what you can do is get well trained in the subject. And that's not so easy. So you need guidance while you are doing your training. So that means that I think you should not do aesthetic rhinoplasty before your residency is over and maybe even after fellowship. And still then you have to re-evaluate your rhinoplasties and try to get better all the time. And that takes effort.
No, Peter, I mean, I've got so much respect for that. I mean, you've been in the game for 28 years. And just to caution people about it, because this world we're in now is so Instagram and quick results, etc. I mean, this takes years to get there. So this is a more difficult question. In this world of rhinoplasty, technically in surgery, what do you find is possibly for you the most challenging or most difficult part of the operation? And then kind of next to that, the most satisfying? Because often to get the difficult stuff right gives you greater satisfaction sometimes. But
well, I don't know, man. The thing is like this. I see it as per case. As soon as I decide to do the surgery, then I kind of feel a responsibility to that patient. All right. If it's not doable, I rather don't make the deal. You know what I'm saying? Because I want to be happy as a surgeon too. And some noses can just not be fixed, or you cannot get it what you have in your head or what this patient has in his head. So, whether it's a primary or a revision rhinoplasty, it's just a kind of deal that you make together. That's why the consultation is so important. You kind of make the deal together. You say, all right, this is possible. If you want this, well, I'm not going to do it because I don't like it. If guys want a scoop nose, which you sometimes see, right, I'm not going to do it. I don't like it. I want to make it a tough nose, a better nose, but a tough nose. And it kind of gives a selection of patients already. And then you kind of end up with patients that like you and trust you. And you have patients which you think have reasonable expectations. And then you kind of go for the surgery. Because I always tell them that there's like one thing you can steer, that is that it must sound logic what my plan is. If it sounds logic to you, what I'm saying, right, then we are on the right highway to Cape Town, and not on the highway to Johannesburg and then to Cape Town. You know what I'm saying? It's like completely different. And they kind of get that. And they also need to understand that it depends on the anatomy available, what you can do with the nose. Because you not can get a 10, like a small lady. Sometimes they come with pictures. It's just not possible. You get the best out of the nose. And then, when you compare it to other noses, it might be a little bit worse. But at least for you, that's the best you can get. And it should look natural. So I don't like the pointy scooped tips with very small bones, with a pointy tip, which sometimes is good, but sometimes is too much. That's just not my style. So what I do is I just show them what I like. And I have a website where they can see what my taste is. And then you kind of get your patient selection by itself, which you will have as well.
Wow. Okay, Peter, I've got two more little topics or questions. The one is, how do you find balance in your life, man? Yes, between publishing your own books and speaking around the world and running a practice, and it's all over Europe. And how do you keep the resilience going to carry on like you do and yet remain balanced in what you're doing?
Well, what I do is I do a lot of sport, so that's and I do nice things. But what I start doing when I was getting older, I was just cutting things. So I started giving less lectures. So this Zoom was much better. So you don't have to go jet lag, fly. You meet less people. So also I always tell my business partner Boris Filipovic, say, right, fame is like a balloon. If you don't keep blowing, it kind of goes down. So you have to kind of keep on giving lectures, like with you do with the podcast, etc. They have to see your face all the time. Otherwise, it will disappear a little bit, but that's fine. I stopped writing books. I only publish when I publish along, so I correct it, but I don't set up new studies anymore. So you have to kind of get selected. That's also the advantage of aging. In the cancer center, we have like 2 fellows. We have residents. We have a fellow in Zagreb. You get a lot of help, and you don't have to do all the small things anymore, which is a kind of a natural process. And I think more and more you start creating structure for others to work in and find the best of themselves. So now I get older, I appreciate more the residency program in Utrecht that I had. That's why I called it the Utrecht Questionnaire, because they created the theater that we were kind of playing on, you know what I'm saying? But it's not so easy to create the theater. We were doing like, I don't know, 70 tracheotomies. Now they do like 4, and we got them all over the place. And I did my first commando alone without supervision when I was in my 4th year. Now that's unthinkable.
Yes,
because now even with the ear tube, they need like supervision, and it all takes time. And it's good, because you have less mistakes, but the whole system is kind of so paperwork-like that you cannot really quickly excel anymore. Although the education is much better than in the past, of course.
Yeah. Peter, another question I had for you is, I know you do a lot of rhinoplasty and like facial plastic stuff, but skin cancers, nasal skin cancers, that's also something that you enjoy, eh?
Yes. So in the cancer center in Amsterdam, we see a lot of skin cancer, melanoma, Merkel cell, basal cell, and usually whatever they don't want to do after Mohs surgery, for example, because they don't have anesthesia, they send to us. And it's kind of really nice as well. We have a prosthesis, so they make silicone prostheses with screws. So we have that available. And what is operable, we operate with inner flaps, cartilage, and usually forehead flaps. But also over the whole face, actually, but not only the nose. But that's really kind of nice to do. It's it's necessary, and those patients are also easier satisfied because the expectations are a little bit lower than with the aesthetic rhinoplasty.
That's great. So Peter, the listeners don't really know about, we've got a very funny little WhatsApp group, a humor group between the rhinoplasty surgeons, just so that the guys can blow off some steam. And I know you're quite a good contributor to this group. You've got a great sense of humor. So tell the listeners a funny story that's happened in your career, if you can think of one on the spot.
Not really, man. It's kind of, I kind of miss the meetings. It was kind of always nice that you saw these colleagues. The COVID kind of really had a big impact on that, man. There's like all the real funny things that you see colleagues and have fun and also know about them other than the medicine is kind of disappearing. But hopefully we will pick that up. So, but I cannot really think of a funny thing. But there must have been a lot of stories, but I cannot really pick one now.
That's fine. Yeah. So Peter, man, thank you. On behalf of the listeners from around the world, I mean, it's fantastic to sit here and listen to you and just be inspired by your journey. Again, a shout out to Medtronic for enabling it. Thank you for helping. And Peter, thank you for your time. Thank you for your honesty. Thank you for what you've done for so many people. I'm sure that you don't even know the impact of setting up the fellowships. I mean, I went and wrote those board exams in Washington 3 years ago as well. And your questionnaire and the book. So thank you. And I hope you go from strength to strength. Eh?
Thanks, man. Thanks for having me, and good luck with all your shows.